I'm Dr. Gretchen Guevara. I'm a psychiatrist and therapist, and I'm also an associate professor of psychiatry. In this short video, I want to talk about depression. Let's just talk about the basics. Here we'll focus on the symptoms and signs of depression. Sadness is a very natural reaction. When we're experiencing something sad, it's very normal and natural to feel sad. We should have our emotions that match the context of our experience. However, if that sadness is pervasive and it's starting to affect your functioning, like your ability to take care of yourself or fulfill your responsibilities at home, at work, in school, or starting to affect your relationships. If that's happening, it's time to pay attention to see if this is depression. Remember that depression is treatable. Let's get started. Problems with sleep is a core symptom of depression. There might be disrupted amount of sleep or disrupted quality of sleep. It might be hard to fall asleep or stay asleep, or even wake up much earlier in the morning than usual. You might experience anhedonia or loss of interest in things like hobbies or social interactions. There might be persistent feelings of guilt or hopelessness, narrowed thoughts, tunnel vision focused on negative thoughts. You may ruminate on thoughts like, I deserve to feel down. I feel like a burden, or there's no way out. You might experience fatigue, low energy, and activity. It's like it's hard to get out of bed. So poor sleep, low energy, and ruminating thoughts lead to problems with concentration and can affect performance in the different areas of your life like school, work, or interactions with others. Appetite is often low, leading to weight loss and in severe cases, malnutrition. There is a general slowing typically observed by others around you. Your speech, movement, or thinking just seems much slower than usual. In severe depression, the rumination and constant feelings of worthlessness, guilt, hopelessness, and inability to feel pleasure can make one think suicide is the only way out. It's important to remember that depression can be treated, and seeking help can be the next life-saving step that one needs to take. A diagnosis of clinical depression typically means that at least 5 of these symptoms on most days of the week or at least 2 weeks are present. There are many other possible signs and symptoms of depression that could include monotonous speech, slouch posture. Sometimes you might even have anxiety. Lack of motivation is another very, very common symptom of depression. For others, you might experience unexplained medical or physical problems like stomach issues or headaches where you don't know where it's coming from. Other people might even experience dissociation or feeling like you're out of touch of reality. Depression involves complex mechanisms in your biology, psychology, and how you interact with your environment. Your life story is also very important. Your past and your present situation can have impact on what you're experiencing now. It requires careful attention, assessment, and understanding of what your experience is in order to identify the proper treatment or approach to make you feeling better. Remember that treating depression or any other mental health conditions or experiences require a multi-angle approach. That can include lifestyle changes and paying attention to your self-care. For some people, medications may be needed or psychotherapy, and for all of us, we need skills to make sure that we know how to take care of those thoughts, so that it's not causing emotions that lead us to depression. For more basic information about depression, make sure to click on the next video. See you then.